Hello everyone, Dr. Mark Russo from Naples Nephrology, wanting to review many of the things or some of the things that you and I may have reviewed in the office, as well as one of my associates, whether it be the nurse practitioner, physician assistant, or other physician. So you've been diagnosed with chronic kidney disease, some label that we have to put on you for the majority of the time billing purposes, but you have some mild kidney problems or maybe some advanced kidney problems. But we can apply many of the things that I'm about to tell you, you can apply throughout that spectrum of the disease process. First thing is really protein. Maybe you've been diagnosed with having protein in the urine. Should we be limiting the amount of protein in our diet? And the answer to that is simply watching and doing things in a moderate basis, on a moderate basis. Meaning that you're not going to be eating a steak every day or 3 hamburgers a day. Just have to use a little bit more common sense and reduce it. We ask that the protein at your meal be no larger than your hand. If you can fit that amount of protein in your hand, that's fair, and you can eat that protein. The types of protein, yes, we try to stay toward the lean meats and fish and chickens, etc. But you can eat the other meats. You can eat the steaks as well. But again, we ask that you be cautious and limit them. Probably really the most important thing is to limit the sodium intake. The typical amount in the American diet is 13,000 milligrams a day, 13,000. We ask that you take in about 2,000. Some of us, our kidneys, what can they handle? Anywhere on a couple of thousand milligrams, upwards of 6,000 to 7,000 milligrams per day. You've got a little bit of leeway, but we ask that you limit that sodium intake. So you've got to start reading labels. If you haven't done so, start reading them and look at. Be really careful. Always look at the amount of sodium per portion. Stay away from canned foods. Canned foods have significant amount of preservatives, and preservatives mean sodium. So stay away from that. Blood pressure and blood sugar management. This is key. You need to get a blood pressure cuff. We like the Omron. Full disclosure, I have no stock in Omron company. I don't own it in any way. So please, we like that machine. Get one with a very large cuff that's going to fit in your upper arm. When you're taking your blood pressure, you should be sitting in a quiet environment for at least 15 minutes. Both feet flat on the floor, left arm resting on the table, and you can take your blood pressure. If now we ask you to take your blood pressure standing up or laying down in bed, you need at least 2 minutes for your body to equilibrate before those blood pressure readings can be reliable. Don't become over obsessed with taking your blood pressure readings. If we say monitor them on a regular basis, we may ask you to just take it a couple of times, maybe 2 or 3 times a week. Maybe we'll ask you to do it more, but the more important thing is writing down the time in which you take it and the day at which you take it. Don't always take it the very exact time every day. We would like to see your blood pressure changes over the course of that day. And we also like to see it in relationship to meals. Some people have a large blood pressure fluctuation after they have a salty meal. So please be aware of that. Blood sugar management. As your kidneys get weaker, blood sugar medications stay around a lot longer, especially insulin. So now that puts you at increased risk of dropping your blood sugar. Low blood sugars are more detrimental and harmful than are the higher blood pressure readings, especially in this setting. So really be careful about that. Monitor those blood sugars, especially if you've been diagnosed with chronic kidney disease. Your weight. You really have to know. Many of us, the majority of individuals in the United States are overweight. You've got to lose weight, and you've got to get down to a more respectable weight, so this way your blood pressure becomes a little bit easier to control, and your blood sugars can become a bit easier to control. If you're struggling with this, talk to us about, and your other physicians, let's have a discussion about the interventions that are available for people that have obesity. But you've got to be willing to take in many less or fewer calories on a daily basis if you proceed with one of these interventions. We also like to say you've got to exercise. If you're not walking 20 to 30 minutes a day, stationary bicycle, you can't sit in front of the television doing nothing. Even if you have a stationary pedal, something, you've got to be doing something. Talk to us about that. Maybe you can't, maybe you cannot ambulate as well, but there are other things that you can do. You can pick up the weights, small amounts, You can get out there if you're wheelchair bound. You can try to you can then manipulate yourself outside and not be as dependent upon a family member or friend as you were doing previously. We are going to push you to exercise more. Diet. Is there a specific diet? We hear this over and over and over again. Doc, what is a specific kidney diet? How can I keep my kidneys healthy? As I mentioned a few seconds ago, it was really about sodium, low sodium intake. But if you really want to lose weight and really get down, you've got to now avoid foods that are white. Not all foods, but most foods that are white. Potatoes, flour, bread, pasta, sugar, and salt. Those are the things that I really ask you to I don't want to say 100% avoid, but you've got to take in less. And rice, of course. Rice is white. These are things that are high in carbohydrates and will just sit in your body and take a long time to metabolize. So the less of them you take in, the less worry you have about them staying in you and worrying about them turning into some sort of fat or feeding the fat rather than feeding the exercise or feeding your brain. Those are some of the minor things that I wanted to discuss. If you have chronic kidney disease, I've told you what your creatinine is. Many of you on the back of your card, you've been given a card for your next follow-up visit. On the back of that card should read your creatinine and should read the conversion to what your GFR is. Reminder, GFR, glomerular filtration rate, parallels what your overall percentage kidney function is. Not quite exactly, but it parallels it. It's close enough to say, yes, that's your percentage kidney function. The number that we're concerned about is your GFR or percentage function gets close to between 10 and 15. Those are dialysis times. If your GFR falls below 20, that's the time we can refer you for kidney transplant evaluation. So if we say pull the trigger and you have to jump, you better jump and get to the transplant center and have them evaluate you. It doesn't take a day or 2 days or 3 days. It takes weeks to months to undergo that evaluation and to be listed. We would rather have you burn up time on the transplant list before you're on dialysis. We would love to see you transplanted before you ever see or hear or witness what is a dialysis machine. It is so much better for you overall as an individual, both health-wise and length of time on the planet will be if you get that transplant sooner than waiting and being on dialysis for a number of years. Stay healthy. If there are any questions that come up, not only regarding this video, you can jot them down and bring them into the next visit with myself and one of my associates. Other than that, have a great day and thank you for listening. Dr. Mark Russo, Naples Nephrology.